I am the Director of Clinical Training for the Clinical Psychology PhD program here at East Tennessee State University. This is my 10th year with the program, and I think my 7th or 8th is DCT. So I've been here for quite a bit. We are accredited by the Commission on Accreditation through the American Psychological Association. And I'm just going to give a brief little overview about the program and then open it up to any questions that you might have. Excuse me. We are a scientist practitioner model program, and our kind of programmatic emphasis is a little different. Many programs may have different faculty members that do different types of research, and we do as well, but they don't have a cohesive overall program mission. And so we're unique in that aspect. Our programmatic mission is to train clinical psychologists to work in the context of integrated healthcare, and also to train clinical psychologists to work in rural environments and understand needs specific to rural populations. Given that we have a generalist model of training and that we want to train people to be able to handle a variety of different presentations and presenting problems and needs from clients. And we have an interprofessional training focus in that we train people to work in healthcare settings with nurses, physicians, nutritionists, pharmacists, the kind of broad array of healthcare practice. And you see that as early as the first semester of a person's admission to the program, in that our clinical interviewing course is an interprofessional course taught with medical students, nursing students, pharmacy, and social work. And occasionally there are some public health students in there as well. So we do a lot of cross training. We also have a lot of placements, community placements for clinical training that reflect that programmatic mission, in that we have a variety of placements in different integrated healthcare settings for both adults and children. And then we also have specialty training as well. So within that, we have faculty and students who have their own specific interests. And so, for example, we have faculty who are interested in addictions. And so we have placements within addiction health treatment. My area of interest and emphasis is forensic psychology. And we also have placements where people are working with justice-involved clients, or Division of Children's Services and justice involvement with family court, that sort of thing. Our training curriculum, it is a master's to PhD, although we do admit people who have master's degrees already as well. It's 4 years on ground of coursework, and then the 5th year is a full-time internship that is usually somewhere else, although we do have internship sites locally within the Tri-Cities region here also. Students are afforded at least 4 years of funding and tuition waiver. Sometimes people need a 5th or 6th year, and I've always been able to give people funding if they wanted it. Some people, if they're just finishing up their dissertation and applying to internship, they don't want the funding because they don't want to take a full-time course load. But our current stipend is $13,000. And then that comes with a full tuition waiver, both in-state and out-of-state. And then for the first 2 years of a student's time in the program, they are working for their graduate advisor, doing research or teaching assistant responsibilities for 20 hours a week for the academic year, which is August to May. And for the second 2 years in the program, the student is funded to work 20 hours a week in a community placement. And so those range. Right now, we've been able to offset, some of them pay less than others, and we've been able to offset that so that they all still pay that $13,000. Although we have 4 positions currently that are grant funded that are funded at a much higher rate than that. So, excuse me, students typically, they're taking a full-time course load, and then once you add in research milestones and responsibilities and clinical training, it's a pretty heavy load throughout the graduate program. But we've so far graduated think 42 PhDs in clinical psych, and we have 100% licensure rate, 100% pass rate on the EPPP, which is the licensure exam. And the majority of our graduates, given our programmatic focus on integrated healthcare, probably 2/3 to maybe even 70% are employed in some kind of healthcare setting, whether it be a clinic or a hospital, with others employed in traditional mental health settings, and a couple are academic, so they're in colleges or universities. Trying to think if there's other aspects of that. In terms of, I mentioned, our programmatic mission too in rural psychology. Not all of them are employed in rural settings, but many of them are, or settings that have a rural reach, in that their clients are people coming from more rural locations to receive services from them. We have about 2/3 of them are employed in what is called a medically underserved community, as designated by the Health Resources Services Administration of the US. And so they're working with people who otherwise might not receive care, and in particular might not receive mental health care due to mental health provider shortages in those communities. So we have very much tried to build a program that can help address inequalities and difficult barriers to access in terms of healthcare and mental health care in the US. So that's just a brief little snapshot. And Victoria, I realized you may have been having some login problems there, so you probably didn't catch all of that, but I'm happy to open it up to questions right now and answer any questions that you guys may have.